Hello everyone, I'm Dr. Shamsundar, radiation oncologist from Precision Oncology Clinic. Today I'll be talking about staging of cancer. This is a very common, question that everybody wants to know, and even patients want to know what stage is my cancer, what stage is good, what stage is bad. Each cancer has a different staging system, but most, as a if we generalize, most commonly, most of the cancers are divided into 5 stages. One will be stage 0, which we also call as a pre-malignant stage, or a carcinoma in situ stage, which means that the cancer has not yet gone into the depth. Then the cancer is divided into stage 1, 2, 3, 4. Stage 1 cancer is those cancers which are limited to the organ itself. Stage 2 cancers are those cancers which are there in the organ, but there is a chance that it would have spread to the nearby lymph nodes. Stage 3 is the cancer has spread from that organ to other nearby organs and also to the lymph nodes. And stage 4 is that cancer which has spread through the blood from that area, that is that organ, to other organs. So for example, like we will take now oral cancer. Sometimes you will see some patches in the oral cavity, especially those who chew tobacco. That is called white patches are called leukoplakia, and red patches are called erythroplakia. Sometimes when we do biopsy, we find some cancer cells, but they are still limited only to the superficial area, and it has not gone inside the tongue. These come as carcinoma in situ, and that will be stage 0. Now, if the cancer is there, limited only to the tongue, very small, less than 2 centimeters, that will qualify as stage 1. Now, when we come to stage 2, then the disease would have increased a little more. Size will be bigger than that, more than 2 centimeters, and there is a chance that these cells would have already got to the lymph nodes situated in the neck. That will be stage 2. Stage 3 will be when the cancer size has increased even more than 4 or 5 centimeters, and definitely the neck nodes may be involved. Stage 4 will be when it has spread to other parts, like from tongue it has gone to lung or it has gone to liver, then it will become stage 4. So this will differ for different types of cancers. This is an example that I gave. So generally speaking, stage 4 is bad, stage 1 is good. So what is the importance of stage? So the cure depends on the stage of the disease. Higher the stage, bad is the outcome. Lesser the stage, good is the outcome. So for example, if I have to tell in carcinoma breast, which is the most common cancer worldwide in women, even in India. So if a patient is diagnosed as stage 1, and if the patient is treated adequately and appropriately, then the cure rates are 95%. In stage 2, the cure rate becomes 92% with appropriate treatment. As soon as it goes to stage 3, the cure rate falls to 70%. And once it is stage 4, it will become 20%. So you can see from stage 1, which was 95%, it has gone down to about 20-25% in stage 4. So it is always important to get diagnosed earlier so that the cure rates are better. So the next question will be, sir, is this stage the only thing which will determine the outcome, or are there something else? So stage is not the only one which will determine the outcome. There are other prognostic factors like histopathology. That is the type of tumor, mainly the grade. If it is low grade, then it is good. If it is high grade, it is bad. And then there are other factors, prognostic factors such as prostate specific antigen, PSA, in CA prostate. The higher the PSA, bad is the outcome. And also like in breast. So we have some markers called ERPR and HER2. So if you have this ERPR, that is hormone receptor positive, then these patients tend to do well compared to those who don't have this ERPR. So these are the other prognostic factors. So staging along with other prognostic factors gives us the outcome of the patient, in which staging plays a major role. How can we make use of this? So how can we make uses? If the patient comes to the doctor immediately when they have an issue, when they have a problem, when there is a symptom related to cancer, then these patients can be diagnosed very early, and their treatment quantum also will be less, and the cure rates will be very high. So in conclusion, there are 4 stages and also a stage 0. Stage 0 is mainly carcinoma in situ or pre-malignant. Stage 1 is very early. Stage 4 is very advanced. If you are diagnosed in an earlier stage, the cure rates will be much higher compared to advanced disease. Thank you.